associate those two things with the sympathetic nervous system, the ganglia of the parasympathetic nervous system. There's only one of them. Terminal ganglia. So you associate terminal with para, and then the other two collateral, parasympathetic sympathetic ganglion chain, with the sympathetic nervous system. That's all you have to know. So these two things right here, I got right here. And where did I get terminal ganglia? Right there. All right, it's underneath parasympathetic nervous system. One other thing that's important to know is when it comes to the motor output of the parasympathetic nervous system, 75% of it comes from the vagus nerve. Your vagus nerve plays a vitally important role with your parasympathetic nervous system. If you have a neuropathy of the vagus nerve shortly after it comes out of the brainstem, you're in big trouble because you're going to lose control over a lot of things in the body, a lot of things. All right, so that's another important point. Okay, now let me show you a picture of both the sympathetic and the parasympathetic. That's on file. Sympathetic is this blue shade, parasympathetic is the pink shaded stuff. So, parasympathetic, cranial, sacral, that's we know, right? The solid lines, that would be your preganglionic neurons. Look how long they are. All right? Sympathetic nervous system, solid line, preganglionic, and then the postganglionics, those are the dotted lines. Those are long. Things that you have to know. This is the paravertebral sympathetic ganglion chain. This whole thing here that I'm scrolling through. Now they only put one, there's two, it's on either side. Look at the vertebral column. Okay? Here's your spinal cord, thoracolumbar region. That's the motor output of the sympathetic nervous system. This picture on the left is that. Except a bit more faint. That picture right there, this is the one on the right. Okay? Now, you can't see the, well, I guess they do show every once in a while. There's a ganglion right there. These are the terminal ganglia. That round circle, that round circle, that round circle, that round circle. Those are terminal ganglia. These right here, these are the collateral ganglia. Boom, 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 and boom. And again, this is that chain, the paravertebral sympathetic ganglion chain. And again, all you have to know is the names of them and what they're associated with. The ganglia have names. That's all you have to know. All right, when it comes to the ganglia. All right? Are we good? Now what are we going to do? Now we're going to talk about specific receptors and what they do. So we have our adrenergic receptors and we have our muscarinic receptors. So what we're going to do now is this. We're going to talk first about these receptors right there. All right? Adrenergic receptors are receptors that are associated with norepinephrine. Correct? You already know that. You wrote it down. Now, when it comes to adrenergic receptors, and I'm not sure if I told you this. If I did, good. If not, good as well. Adrenergic receptors. I did, right? Alpha 1, alpha 2, beta 1, beta 2, beta 3. Did we do that? Okay. So, these adrenergic receptors, that's what we're going to talk about. We're going to talk about those individual receptors, and there's 5 of them, where they are, how they work. So what we're going to draw is this. That's going to be our first, and it's going to be a big picture. It's going to be a whole page. All right? So, we're going to draw the brainstem and the spinal cord kind of in the middle of the page, then we're going to have some stuff to the right, and we're going to have some stuff to the left of it. Up to this point, I've added all this stuff to the right of it. There's not enough room to put it all on the right. So, brainstem, spinal cord. Okay? Cervical region, thoracic, lumbar, sacral. And we're going to talk about the sympathetics first. So we're going to take a preganglionic neuron. I'm not going to draw the myelin. It's just going to waste time. I want to get done tonight. We don't have to get done tonight. I just want to get done tonight. This is going to give you more time to talk about muscle, which takes a long time to talk about. We're going to draw an effector, smooth muscle. Smooth muscle that wraps around your blood vessels. The smooth muscle that wraps around the blood vessels have alpha-1 receptors on them. So we'll label those alpha-1 receptors, all right? We're going to release, obviously, norepinephrine. That's what adrenergic receptors do, they bind norepinephrine. When norepinephrine binds to those receptors on those smooth muscle cells, what's norepinephrine going to do? Excite them. So alpha-1 receptors that are on your blood vessels are excitatory, meaning what? They're going to depolarize those smooth muscle cells. They're going to excite those muscle cells, smooth muscle cells. And when muscle cells get excited, they contract. So what's going to happen as a result of this is we are going to constrict those blood. Those tubes are going to do this. They're going to get squeezed. All right, the diameters are going to get smaller. That's what alpha-1 receptors do. So alpha-1 receptors are excitatory when it comes to blood vessels. All right, now if you notice in your notes, it also says that they can be inhibitory. We already know how that works. Right, we talked about that. Talked about neurotransmitters and how they can be inhibitory and excitatory. They work through receptors, so I'm repeating something that we already know, right? Norepinephrine is either excitatory or inhibitory. In this particular case, the next one I'm going to draw, we're going to see that it is inhibitory. So I'm going to draw another tube, but that tube is not going to be a blood vessel. That tube is going to be your digestive tract. Meaning what? Your esophagus, your stomach, your small intestine, your large intestine, which in essence is just one big long tube. And on the smooth muscles of those organs, we also have alpha-1 receptors. That releases norepinephrine, obviously, onto those receptors. So these particular smooth muscles, what's going to happen to them? They're not going to get excited. These are different kinds of smooth muscle cells. They have different stuff that happens inside of them. So instead of excite, we're going to inhibit. Instead of depolarize, we're going to hyperpolarize. These muscle cells are going to relax. So when norepinephrine binds to alpha-1 receptors that are on smooth muscle cells that wrap around your digestive tract organs, it will relax that muscle. Okay? You are going to inhibit your digestive tract. So your sympathetic nervous system inhibits your digestive tract. Your sympathetic nervous system causes your blood vessels to constrict. Again, that's the big picture, right? Is this a sympathetic nervous system? Of course it is, because it's coming out of the thoracolumbar region. Of course it is. All right? So that's alpha-1 receptors, either excitatory or inhibitory, depends on the cell. Alpha-2 receptors are inhibitory. By the way, these aren't the only places alpha-1 receptors are located. I'm just giving you a couple of things. Maybe we could spend all semester talking about alpha-1 receptors. Don't have time. Now we're going to draw the postganglionic neuron big. Okay, because we have to draw a couple of things on it. A couple of kinds of receptors. So here, I'm just going to have effector. Doesn't matter which one. It could be smooth muscle, it could be the cardiac muscle, it could be it doesn't matter. All right, just some effector. And we're going to be releasing here whatever, norepinephrine, if we're talking about most instances, that could be sweat glands, so that could be acetylcholine, it doesn't matter. All right? The receptors that we're going to be talking about are on the postganglionic neurons. Alpha-2 receptors are there. All right? What receptors are these? Remind me what receptors those are that I've just drawn. So if I had to label those receptors, what would I call them? That's a postganglionic neuron, and we're releasing acetylcholine here from a preganglionic. What are those called? Starts with an N. Nicotinic. Can we have more than one kind of receptor on a cell? Of course we can. We can have hundreds, and that's what we do have. All right? So, the nicotinic receptors are going to bind acetylcholine from the preganglionic neuron. We're going to have another neuron here, and I'm going to call it just that, other neuron. And this other neuron is not going to be releasing acetylcholine. Instead, it's going to be releasing norepinephrine. Of course it is, because it's going to be binding to an alpha-2 receptor. If those two neurotransmitters, acetylcholine here and norepinephrine, released or were released at the same time, what would we have? Tell me what that's called, please. Summation. What kind? Spatial. Have I touched anything there? No? I'm repeating something that we've already learned. I'm just showing you a specific example of it now. We can have spatial summation here. Alpha-2 receptors are inhibitory. So if we hyperpolarize this postganglionic neuron, because we release norepinephrine onto these alpha-2 receptors, should we have more or less action potentials along this axon? Should action potential frequency go up or should it go down? Down. So we should have a decrease in action potential frequency. Is that anything there? Will we have more or less neurotransmitter released onto that effector? More or less? What's the first thing that you need to release a neurotransmitter? What's step number one? An action potential. If you have more action potentials, are you going to release more neurotransmitter? Yes. If you have a decrease in action potential frequency, are you going to release less neurotransmitter? Yes. So what does this alpha-2 receptor do? What is its job? It decreases neurotransmitter. I have no idea why the hell that thing is in the way. Try it again. You have a decrease in neurotransmitter, that's what that says. Release. Where? Right there. Why? Because we don't have as many action potentials. Why? Because we hyperpolarize. How? That receptor right there on the postganglionic neuron is inhibitory. That's how. All right? Are we good? Alpha-2 receptors are inhibitory. Alpha-1s are excitatory or inhibitory. It depends, yes. Oops, yeah, let's just say decrease. Down. Okay, it decreases neurotransmitter release. All right? It's a way of controlling very closely how much neurotransmitter is released there. That's why this happens. All right? Are we good? We just drew this, by the way. That's what we just drew. Don't worry about negative feedback. Don't worry about it. Okay? Just know that you're going to get a decrease in release. Beta receptors, we're going to put that on the other side. That's why we put this in the middle, because I got to put stuff on the side too. All right? So, you're going to have a neuron come out of the thoracic region. Short preganglionic, long postganglionic, and we're going to have the heart. Beta-1 receptors. As soon as you hear beta-1 receptor, you think heart. All right? So when norepinephrine is released onto these beta-1 receptors, what's going to happen is we're going to excite the heart. You're going to make the heart beat faster. You're going to make the heart beat harder. Your sympathetic nervous system stimulates your heart. Okay? And that should make sense given what the sympathetic nervous system is for. Fight or flight, physical activity, correct? Okay? So, that's the heart. Now we're going to have the beta-2 receptors. The beta-2 receptors are inhibitory. Beta-1s are excitatory, beta-2s are inhibitory. We're going to make a tube. This tube is not a blood vessel. This tube is not your digestive tract. This tube is an airway. These are the tubes that allow air to go in and out of your lungs. The smooth muscle cells have beta-2 receptors on them. Beta-2 receptors are inhibitory. Beta-1s excite, beta-2s inhibit. And so, when we excited these tubes over here, they constricted. If we relax the tube, if we relax any tube, we're going to cause it to dilate. What do I have in the nose? What's the word I use in the nose? I use relax, so I use the same word. We're going to relax. The airways are going to dilate. Okay? Does that make sense? Your sympathetic nervous system is fight or flight during physical